Hi, it's Oscar, the Simple Surgeon, and in this video I will try to show you where to get valuable medical information on the internet. People should get their information from their doctors, from their physicians, but often many would like to read more, to get more understanding of their condition or condition of those close to them. The trouble is, if you get the wrong information, this will be a misunderstanding of the nature of disease, not the understanding. When I search for medical information on the internet, and I do so, I don't know every disease. I use valuable sources. For example, if I'm searching a certain condition, I'm putting it in a internet search machine engine and add emedicine or medscape. These guys have information for medical personnel mainly, but is peer reviewed, so every information is checked by 2 other medical doctors before it is published. It is not perfect and it's not guaranteed, but it gives you a lot of confidence into that kind of information. So avoid forums and groups and chats. Often those places have people who have no clue what they're talking about and often have misleading information. You have no way to clarify if they're competent or not. Consider, it's not bad, consider blogs or web pages of medical people who you can verify. I have a friend who's a pharmacist and he's a blog on drugs, and I trust this blog because I know he has competence. But look for viable, good information websites, and these are provided by the institutions. So emedicine Medscape is the one. I'm using it most often. You can also try to see certain information on some established hospitals like the Mayo Clinic, for example, or even on the web page of your own local hospital. It will be a good information and it will be right on spot for your particular situation. You can also go to the web pages of the medical colleges, established medical schools. If you want to learn, why not learn from the best? Go to the Harvard Medical School or the Oxford one or any other well-established medical school. If they have information for the patients or for the doctors or any information that can be useful, use that. Why not? And local medical editors, the editors of the medical journals, often supply information for the patients. I practice in Poland at the moment, and we have a publisher called Practical Medicine at mp.pl. And apart from supplying information for the medics, there's also the whole huge section for the patients, which is written by the medical people and checked and gives great information and adequate and focus on the local perspective. So not only what to expect from the condition, but what to expect from the health system in a given place in the world. Now, you know where to look for it, the information, but what to look for? Information for the patient should be the best because the language is simplified somewhat. It is adequate and simplified, easier to understand. Use caution when you come across information that is intended for the medical personnel, because in that part you would usually need to log in and confirm you're a medic before accessing these kind of materials. In this part, the authors are allowed to use sophisticated medical terms and utilize shortcuts, not say everything, and omit some information that should be known to everyone who finishes the medical school. Therefore, there is a trap here. Use caution and avoid or beware of reading a direct result of medical research. First of all, the result of one research does not mean this is the truth. And I have a whole series on evidence-based medicine and the research and the scientific method, caution about those traps that are there. And second of all, you would need to know how to read it. If you are a medical person and would like to know how I think medical research should be read, please refer to my video on November the 28th, 2020, which is titled How to Read Medical Research. I think I've said enough. In any doubt, please refer and consult your physician. Remember, if you don't understand one doctor, you are always, in every jurisdiction that I know, you are always entitled to search second opinion. If you do not understand your general practitioner, you can change it. I have recently changed a general practitioner for my own mother because he wasn't expressive enough to explain things. So, any doubt, consult your physician. Everything I said here is my opinion, and I am just a simple surgeon, but I still hope it was useful. Thanks. Bye.